Well, good morning, Nurse Converse community. Today, I will be having a conversation with no other than Rear Admiral Moon. Thank you all for joining me. So let's just get right into it, and I will share with you all who Rear Admiral Moon is. Rear Admiral Moon's career has been marked by opportunity and service, manifested through the constant pursuit of excellence, having earned her Bachelor's of Science degree in nursing from Armstrong State University. Rear Admiral Moon began her nursing career as an emergency room department fellow at the Washington Hospital Center, followed by service in the health insurance industry, leading in several critical capacities. In 2002, Rear Admiral Moon joined the Centers for Medicare and Medicaid Services as a consultant, where she served as a surveyor of nursing homes and intermediate care facilities, earning her commission as a lieutenant in the United States Public Health Service in 2005. Rear Admiral Moon successfully supported numerous roles in the Division of Immigration Health Services, now known as the United States Immigration and Customs Enforcement Health Service Corps. Transitioning back to the Centers for Medicare and Medicaid Services in 2013, Rear Admiral Moon helped to lead the implementation of the Affordable Care Act marketplaces, followed by numerous high-impact leadership positions, supporting the Centers for Medicare and Medicaid Services mission. Appointed as Chief Nurse Officer for the United States Public Health Service Commission Corps in 2023, Rear Admiral Moon has pursued excellence through her vision of the HOPE framework: honor, obligation, purpose, and empowerment. Rear Admiral Moon is a board-certified family nurse practitioner, completing her doctoral degree in nursing practice at the University of Maryland in 2020. Rear Admiral Moon also holds a Master's of Science degree in nursing from Marymount University and a Master of Science degree in public health from Emory University. Thank you so much for joining us today, Rear Admiral Moon.
Thank you. Thank you for the invitation. I'm so happy to be here with you today.
Absolutely. Well, I just want to get started because people are going to want to know a little bit more about why we are in these uniforms. So I'll just share a little bit about the United States Public Health Service. And throughout the interview, you all may hear us refer to it as PHS or USPHS. So please do know that that is what we're referring to. So the United States Public Health Service is one of the 8 uniformed services of the government. Our mission is to protect, promote, and advance the health and safety of the nation. So we are stationed all across the United States as well as international locations. And Rear Admiral Moon and myself are both nurses of the United States Public Health Service. And throughout our conversation, she will also be sharing more about her role as the Chief Nurse Officer and what that looks like. But I would like for you to just get started with telling us a little bit about your journey and how you began and your interest of nursing and how you pursued that.
Well, actually, when I went to school, graduated from high school and went into college, I really didn't know what I wanted to do. I enrolled in a liberal arts program at Howard University and kind of fumbled around, wasn't really sure. I didn't have clear direction. My mother's a teacher. Mm-hmm. I had my favorite auntie as a social worker, so those were my role models. So I thought I would probably pursue either one of those, but I wasn't really sure. Nothing was really fitting for me. So I actually left school after about 2 years or so and got a job working at Blue Cross Blue Shield, where I met a nurse who was working there as a utilization management nurse. And I found out for the first time, I realized how much nursing can do. There's really no limit to what we can do. And I always thought of nurses as being at the bedside, that sort of thing. I had limited medical experience because I was relatively healthy. Speaking to her and learning about how her journey and how she became a utilization review nurse inspired me. So almost immediately, I actually got a pink slip from Blue Cross Blue Shield. They got rid of my position. So at that time, I said, well, I guess I better go back to school. So I did. And immediately pursued all of the prerequisites for nursing school, enrolled in nursing school, and never looked back. It just, it's like a light went on, and I just knew that that's what I was supposed to do.
Oh, wow, what a remarkable journey. I always find that it's fascinating that some of us come to this profession through meeting someone else and just having a conversation and getting an opportunity to learn the different opportunities within the career. So, thank you so much for sharing that. And I also see that you attended Armstrong State University. Is that in Savannah, Georgia?
Savannah, Georgia.
Oh, interesting. Okay, so did you grow up in Georgia and then relocated to the
Right.
Maryland area?
I am a Georgia peach. My father is Air Force, flight engineer in the Air Force, and he was stationed in Savannah, Georgia, Hunter Air Force
Mhm.
Base, and I was born there. So I thought it was interesting that I actually ended up returning there to go to nursing school. It seemed like just perfect the way that it worked out. It was meant to be. So yes, Air Force brat and Georgia peach.
Wow. So it sounds like the mission of service is well within your family.
Very much so.
Oh, that's beautiful. That's so beautiful. All right. And then what I also wanted to discuss today is some of the things that we experience, especially within the nursing profession and just kind of getting through now the COVID pandemic. And with you being in a leadership role, can you share a little bit about any experiences you've had with burnout and resiliency?
Oh, absolutely. I just like everyone else during COVID, I actually was teaching as a clinical instructor
Hmm.
at Bowie State University. And in addition to everything else I do, I just felt the need to give back and try to do what I could to train the next generation of nurses. And so, just part time, a clinical instructor. So, I was able to go into the ICUs and to the emergency departments and actually see the impact that COVID was having on not just the public patients, but on our nurses
Hmm.
and talking with them and experiencing that burnout with them and talking through some of the issues they were having. So, yes, I personally experienced burnout as well throughout my career, even now. I wear several different hats, and some days I just feel exhausted. So, for me, it has to go back to self care. And I talk about perseverance. Is what I try to encourage nurses to think about perseverance. And what does that mean? That means making sure that you just keep going forward, keep moving forward, keep taking little steps, set little short goals, long-term
Hmm.
goals as well, but it's important to have those short-term goals so that you're realizing some successes along the way. Also, focusing on the journey,
Hmm.
not the end, just enjoying the steps along the way. Staying positive. Negative takes so much energy. I think that I'm energized by positive. I try to keep positive people around me. I try to maintain my positivity. Um, Staying creative and innovative, not always taking, I'm not really one to take a no. I kind of go through no and try to find a creative way to get to yes. Remain patient. And I always try to remember my why. Why am I a nurse? Why am I in uniform? Why am I serving the public? It's something that is just part of who I am. It's part of my DNA. And it inspires me, it energizes me. Also, I practice gratitude daily. I practice grace, not just for others, but also for myself.
Hmm.
And it's important to also maintain balance.
Wow. You really just gave us a wealth of knowledge with those tidbits. So thank you so much for sharing that. And as we're going through this discussion, one of the other things I wanted to speak with you about is in your experiences, you mentioned about just kind of getting through the no's and remembering what your why is. When you look back over your career, what has been the most intrinsically motivating and why?
Purpose for me is purpose, and I included that in my hope framework.
Mm-hmm.
It's just for me, I've always sought what God's purpose. I'm a woman of faith, and
Mm-hmm.
I've always sought what is God's purpose for myself. And for me, it's always resonated service, always being of service. You'll hear me say it's not about me. It's not about me, and that's comfortable to me. It's about service. It's to me, it's a privilege to be of service.
Thank you. And can you recall on anything that has been your
Toughest.
toughest moments? When you look back over your career, any things that.
Yeah, just I started out as an ED nurse,
Mhm.
as you mentioned in my bio, and one of the things that was tough for me, especially as a new nurse, was some of the traumatic experiences, things that I witnessed in the emergency department, which I won't go into a lot of detail, but
Mhm.
as nurses, we experience very, very sad. We interact with individuals, patients, our patients, the people that we care for, sometimes at their lowest point in their life, mentally,
Mhm.
physically, spiritually, emotionally. And so it's tragic for them, and it also is traumatic for us as well. And I still recall some of those experiences early on in my career and how they traumatized me, to be honest. I mean, there's no other way to really put it. And not really knowing how to deal with that early in my
Mhm.
career. So I can think of several situations, again, without going into too much detail, but just traumatic experiences in dealing with patients and their families and the sometimes unfortunate negative outcomes that resulted in their disease process.
Mhm.
So those types of things I remember. Those are points where I kind of have to reflect back and say, okay, I'm here to serve. Sometimes the outcome is not what you would want it to be. It's not always ideal. It's not for, as a nurse, you, of course, you want everyone to recover. You want the best outcomes for your patients and for their families and for our communities from a public health perspective. But that's not always the case, unfortunately. So you have to be able to process that and um, and be okay with it and
Yeah.
learn from it.
And that goes back to your point about resiliency. I think that's one of the most fascinating parts about being a nurse is we do get the opportunity to witness and also be involved with individuals in all points of life, whether that's through the happier moments or through some of the most devastating that they never would have saw for themselves. And it's truly a blessing to be able to come into someone's life and be entrusted with that ability to care for them and walk with them through that through
Yes.
whatever they're experiencing. However, it does leave us with some points of trauma, as you mentioned. So thank you for mentioning that and sharing those details with us. Now I would like to go ahead and speak about your career and current role as the Chief Nurse Officer for the United States Public Health Service. How did you learn about PHS?
Well, I was actually interested in transferring to the federal government from Blue Cross Blue Shield at the time. I
Mm-hmm.
actually worked as an emergency, as you already said in my bio. I worked in the emergency department, and then I actually ended up going full circle moment back to Blue Cross Blue Shield and wanted to work in the federal government. I grew up, my father was active duty Air Force, as I mentioned, but when he retired from the Air Force, he went into the government. And so I always had this image that I should work in the government and for job security, which is in this area, in the DC, Maryland, Virginia area, that's not uncommon for people to seek federal government employment. So I went to work for HICFA. At the time, it was HICFA, Healthcare Finance Administration, which is now CMS, as a nurse consultant. And I think it might have been the first day or the first week that I was there, I saw someone in uniform, one of my coworkers, and I asked about it because I had never heard of the Public Health Service, never seen it, knew nothing about it. As soon as it was actually a pharmacist, had a conversation with her about the Public Health Service and immediately knew that it was something I wanted to do. The opportunity to deploy, to be able to serve underserved populations, to really have an impact on public health was something that I wanted to do. At the time, I was actually working on my master's in public health, so I had already established a very deep commitment and interest in public health in general. And so to learn about the public health service was just amazing to me. I immediately found out what I needed to do to convert from a civil service employee to public health service. And it took a while, it took actually almost 3 years to be
Mm-hmm.
able to do that. But
Wow.
as soon as I was able to convert, I did it and haven't looked back. It was the best decision I ever made in my life to be able to serve in uniform, which some of that probably came from the fact that I am an Air Force brat.
Mm-hmm.
So I admired, seeing the uniform service and then the connection into public health. Just, it all made sense to me.
Wow. And it's been almost a 20-year career almost?
Almost.
Wow. That's fascinating.
And it went quick. It goes by very fast.
Oh, that's fascinating. And similar to you, there was a nurse that I went to undergrad with at Grambling State, and I saw on her social media platform she was in uniform. So I reached out and received information from her. And it didn't take quite 3 years. I was just at a little bit over two. But now I've learned that the process is a lot more quicker, and I'll also give some time for you to share about that as well. But yeah, perfect. That's awesome. All right, and then in your role, can you share what some of your personal and professional goals are in your current role as the chief nurse officer?
Yeah, I'm sure it sounds cliche, but professionally, I want to have a positive impact. I want to make a difference. I want to build, as this chief nurse officer in the public health service, I want to build a strong foundation for the next CNO. I
Mm-hmm.
want to inspire those coming next. I want to be an inspiration to junior officers and to nurses across the nation and globally. On a personal level, I have this thing about Maslow's hierarchy, which I'm sure nurses are familiar with. Maslow's hierarchy of needs, and the highest level of that pyramid is self actualization. So I'm
Mm-hmm.
always trying to actualize, I'm trying to be the best version of myself and also walk in my purpose.
Mm-hmm. Thank you. And then you mentioned earlier about your framework of hope. Can you share with us how that has inspired the work that you're doing and more details about that?
Sure. When I was considering applying for this role of CNO, it wasn't something that I had aspired to do in my career, honestly. And many roles that I've had in the public health service and in the government have been because others observed me and said, "Hey, have you ever considered this?" And I'll say, "You know what? I hadn't. I just work and I just try to do the best that I can do." And so several individuals, fellow officers, and others asked me, why wouldn't I consider that? And I said, you know what? Maybe I should. And so I started to think, if I was a chief nurse, what would be my priorities? What are the concerns that public health service nurses are having, but not just public health service nurses, civilian nurses, federal nurses, globally? What are the concerns that are facing the nursing profession? And so all these different issues started coming up.
Mm-hmm.
The retention, recruitment, the issues that we're having with our profession, challenges, uh, burnout, all these type of things were coming into my mind, and I started to think about how can we or how can I address those issues, and it all formulated into this framework of honor, obligation, purpose, and empowerment. Honor. How can we honor our nurses? How can we acknowledge the work that they're doing? Obligation. Nursing is, I don't have to tell you, I'm sure you know, that nursing is the number one trusted profession in the United States.
Mm-hmm.
So that gives us an obligation to the public. That trust, we have earned it, but we have to maintain it and we have to value that. What is our purpose as nurses? Our purpose is to serve. Our purpose is to try to achieve those best patient outcomes, healthcare outcomes. Uh, Health promotion is a major function of nursing from my perspective. And then making sure that nurses are empowered, self governance, making sure that we have a voice, that we're at the table when decisions are made and when policies are developed. So I thought about all those things, and actually, you think about, does the chicken come before the egg or the egg before the chicken? So I guess the hope framework was the chicken, maybe. However, I'm trying to make this analogy, but anyway, so it all just came together, and it just kind of, I didn't start thinking of hope, but then I started thinking, they always say that nursing is the heart of healthcare,
Mm-hmm.
but then I began to think about how we're the hope. There are a lot of challenges facing not just the United States and our population, but just globally, challenges, healthcare challenges. We COVID
Yeah.
really highlighted, exposed a lot of issues that we have in our healthcare system. And so I began to realize that nursing really is the hope for our healthcare system.
Wow. Nursing is the hope of our healthcare system.
Yes.
Knowing what your experience of transitioning over to the federal government, How would you encourage a nurse who's listening right now, or someone who's in nursing school that may be interested about pursuing the public health service? What advice would you give to them?
Well, number one, make sure you do well in school. Study, work on that critical thinking. That's one thing as an instructor that I focus on with my students is focus on that critical thinking, because that's the bread and butter of nursing from my perspective, is the way that we're able to use that nursing process and how we think critically and how we're so resourceful. But as far as a career in the public health service, there are opportunities to apply while you're still in school. We have a junior co-step and senior co-step programs. Certainly look into that and apply if you are able to do that, depending on where you are in your nursing school advancement. I would say reach out, check out USPHS.gov and find out more about the service. Find out if it's something that interests you. One thing that I will stress is that I think that some individuals come into the public health service without realizing that we are a uniform service. We are 24/7. It's a commitment that you're making. And so that does involve, sometimes you may have to deploy. We don't deploy as much as the other uniform services. We're not armed. We're not quote unquote military, but we do have an obligation to serve when there's natural disasters, when there are pandemics such as COVID, hurricanes. I myself deployed to Liberia during the Ebola crisis in Africa. So you will be called to deploy. So I think that that's something that's important to understand. So prior to considering coming into this uniform service, think about if that's something you're willing to do. It's not for everyone, but it is a requirement. So think about that. Think about your commitment to public health. In the public health service, we focus on underserved populations. Most of us, I don't just serve as the chief nurse officer. I'm also assigned to the Department of Homeland Security and ICE, Immigration Health Service Corps, and I serve an underserved population, those that are in detention. Most of us are in positions where we impact underserved populations. So decide, is that something that you're interested in? Also, have a conversation with your family. Because as I mentioned, this is a uniform service and it's a commitment. There's a little bit more than just a 40-hour job that's involved in being in the public health service. So you just need to take all of those things into consideration. And if you think about all of that, you have the qualifications, you meet the criteria, then by all means apply. I do consider us to be an elite group of officers, particularly our nurses. We have amazing nurses within the Corps. Every day when I'm just learning more and more about what we're doing to impact the public health of this nation, I'm just amazed. So those of you that are up to the challenge, I welcome you to apply.
Perfectly stated. There is nothing else I can add to that. You mentioned about serving in those underserved populations, and I myself, before currently working at Center for Disease Control and Prevention, I was on the reservation living and working with the Native Americans there. So I wholeheartedly have experienced that wonderful opportunity to serve those underserved populations. So definitely, anyone interested in applying, please do go to the USPHS.gov website and take a look around and see what opportunities may be available for you and your family to take advantage of. All right, well, moving on to mentorship. So you mentioned that there were individuals in your life who kind of spoke into you and said, hey, have you considered this opportunity, or have you thought about doing this and that? And I found an article on the American Nurses Association, and it was written by Sharon Kuzanza, and she defined mentorship that a mentor assists a less experienced nurse to develop and meet his or her career goals by providing resources, learning opportunities, and ideas to improve performance, as well as helping to identify strengths and weaknesses and evaluating success and failures. Mentoring is essential for the career development and establishment of new nurses and the transfer of years of wisdom and expertise of mature, experienced nurses. So, can you share a little bit about what your experience as receiving mentorship has been? And I also want to notate that you mentioned you also served as a clinical instructor. So, I'm sure there were many of opportunities that where you served as a mentor as well. Can you share about any of those?
Sure. Mentorship to me is about providing guidance, the benefit of my experience, helping those coming behind me to avoid pitfalls.
Mhm.
Some people don't listen though; they want to, have their own, just fall right into the hole and learn. But which is fine because as long it's okay to fail, make mistakes as long as you learn from them. But it's also about appreciation of lessons learned.
Yeah.
For me, I have had not formal mentorship along the way. Surprisingly, you would think that I would be able to name specific people that served as my mentors, but honestly, for me, it has been my father,
Mhm.
who has passed away 2 years ago this month.
I'm
But
sorry to hear that.
he was my mentor throughout my life. Not just my father; he was a role model to me. Whenever I had some kind of question, I would always speak to him, and he would always speak to me, not just as a father, but as a professional, as a
Mhm.
military officer, as a very educated individual. And so I've always valued his advice. And for me, mentorship, it's ideal. I will say it's ideal if you have a personal relationship with a mentor, and that personal contact. That's the ideal situation. And I certainly have many mentees that I have that sort of relationship with, including mentoring and coaching, because there's a difference,
Mhm.
students in the nursing program. But it's also possible to have a mentor that is afar, someone that you just observe from a distance that doesn't even know who you are, but you're watching them and you're learning from their experiences. So don't just limit yourself to thinking that you have to have this formal relationship with someone in order for them to be your mentor. That's not always necessary. You can certainly do it through observational mentorship, I'll call it. Maybe I just made something up. Um, but it's also important once you have gotten certainly to my level that you serve as a mentor, that you
Mhm.
are reaching back. And like I said, sharing my experiences, providing guidance when appropriate. But it's also important for people to learn. And sometimes they do need to make mistakes, and then learn from those mistakes.
Perfect. And you mentioned mentorship and the difference of coaching. And for those who don't know, can you share a little bit about what those differences are with mentorship versus coaching?
So I think of coaching as more similar to a counseling relationship versus the mentorship relationship, where you have someone who's more senior and someone who's more junior, and you're providing that guidance. So it's kind of a more hierarchical relationship, whereas coaching is a little bit more to me like a counseling relationship.
Getting into leadership, speaking with one of the highest ranking leaders within the United States Public Health Service, I would be remiss if we didn't speak about your personal leadership styles.
I am a servant leader, number one and foremost. You'll hear me talk about service, as I mentioned earlier. For me, service is a privilege, and I take that into my leadership style as well. I follow. I'm not always ahead. Sometimes I follow. And I think that's important. I'm not always the smartest person in the room. I recognize that. But as a leader, it's important to surround yourself with smart people, and also to leverage. Everyone has strengths and weaknesses. And so as a leader, it's important to identify what those strengths and weaknesses are. And so that you can help that individual grow those strengths and even work, and maybe even more importantly, work on those weaknesses. But part of being a servant leader is to cultivate those skills in individuals, and so that they can be the best that they can be, so that they can reach, as I mentioned before, that self-actualization. I think about that for myself, but I also think about that for others, helping them to grow and mature to be the best person that they can be. And that's different for everyone. And success looks different for everyone.
Yes, very true. And that really much so goes along with the information that I found regarding the definition of leadership. So according for the Center for Creative Leadership, leadership is defined by three outcomes: direction, alignment, and commitment. And is a social process where individuals work together to produce results that they could never achieve alone. And you just alluded to that by saying, being able to identify other individuals' strengths and collaborating with them to reach those common goals. So thank you so much for sharing that and for your leadership. And as a leader, all the responsibilities that you have, can you share what your practice of self-care looks like and how, what impact it has made on your life?
Yes, and I'll be honest, I haven't been the best at self care throughout my career, throughout my life. Until recently, the past several years, I have made a concerted effort to focus on self care. I can be my worst critic. And I have learned, as I mentioned before, about perseverance and giving grace. I have to give myself grace. And so I've learned, I'm working on that. It's something I have to pay attention to it. I have to be intentional about it. And I have to say no. I think it's important to know your limits. I think self awareness is self care. Sometimes we don't take the time to really reflect on ourselves and understand who we are. Why do we react to things a certain way? And that takes self reflection, and it takes time to do that. And you have to be sensitive to yourself. And so that's how you're able to know what your limits are. And sometimes you have to say no. And for me, I'm someone, as I mentioned before, I'm someone who is motivated to serve. I have to say no sometimes, which is difficult for me, but I'm getting better at it.
Yeah.
As far as self care is concerned, I enjoy my family, my friends, and my hobbies. And also, as a leader, it's important to model self care. That's one thing that I realized several years ago. As a leader, folks are watching me,
Mhm.
and so if I'm not practicing self care, they're not going to practice self care because they're modeling themselves after me as their leader. And so I realized that, and I was like, oh my goodness, I'm doing a disservice to people if I'm not taking care of myself. So it's important to model self care. Um, with those that I lead. I try to create a safe environment for them to be authentic and for them to grow as well. And that's the part of the way that I'm supportive in them in pursuing their own self care.
Wow, that is powerful. And as you mentioned, just being a leader is so important to be able to practice self care, identify within ourselves what that looks like, but then also creating that environment where we're allowing safe spaces for individuals to do that as well. And you mentioned that, and I think that's just very powerful that as a leader, you are doing that. So thank you for doing that. All right, so we have come to a end of our discussion today. So thank you so much for your time, Admiral Moon.
Thank
Before
you.
we end, can you share if you have a call to action, can you share what that would be to the nursing profession and community?
My call to action would be in line with my framework, and specifically for the nurses, it is hope, honor, obligation, purpose, and empowerment.
Well, you all heard it here. Hope. Thank you all so much. And just as a quick overview of some of the things we discussed today, we were able to discuss your career journey from starting as a emergency room or emergency department fellow to now being the chief nurse officer for the United States Public Health Service. We discussed burnout and resiliency, as well as the importance of self-care and creating safe spaces as a leader for individuals who look up to us to be able to practice that as well. In addition, the importance of mentorship versus coaching and what that looks like, leadership, and then lessons learned along the way. So, once again, thank you so much for your time this morning, and thank you all for listening. Please do be sure to share this podcast with other individuals, as well as leave a review and let us know how you enjoyed it. So thank you all so much. Be well and practice self-care. Thank you.